Welcome back. Insurance companies, like many other companies, have been adapting their businesses to the new reality of COVID-19. One such company is Sachiko, which is pursuing telemedicine. And here to tell us more about it is Dr. Alexandra Ames of Ames Medical Services, who after several years of international training and experience returned to Trinidad and Tobago and set up a practice in Woodbrook that deals with family medicine, diabetes in the community, and women's health. Welcome. Good morning, Dr. Ames.
Good morning.
Well, I'd imagine that telemedicine is an innovative response by Sachiko to the pandemic. What is telemedicine and how does it work?
Well, telemedicine is any way of a doctor and patient having a consultation or exchanging information and advice when they're not in the same place. So that could be as simple as a telephone call, or it could be more complicated like a video call like what we're having now.
Mm-hmm. And how has the response been thus far from clients? Hello? How has the response been so far from your clients?
I'm so sorry. Could you repeat the question? I didn't hear you there for a second.
What has the response been like from clients?
Are you asking me what the response from my clients is?
Yes, yes.
Is that what you're asking?
Yes. Mm-hmm. Yes?
Okay. Well, I've been actually offering this service to my clients for 3 years now, long before COVID-19, simply because I thought it was a very convenient way of helping my patients around the traffic problem here in Port of Spain if they had a minor illness, or if, for example, they couldn't get in from work. So initially, the uptake was small. It was especially popular with younger users, so patients in their 20s and 30s. But now, since COVID-19, the COVID-19 pandemic, patients are really, really grateful for this service because it means that not only can they consult me if they have symptoms of COVID-19, but it also really improves access for people who are afraid to come to the doctor's office right now. It also, in my view, keeps my office safe for the people who really need to physically come in, because they can be sure that because I'm dealing with more infectious diseases on telehealth, that they're unlikely to, or less likely, I should say, to pick up something in my waiting room.
Mm-hmm. And what is the process of submitting a claim like? Because this is part of the the initiative by Sachiko.
Yeah, so what Sachiko has done is they have created a PDF fillable form that I have, and once I've confirmed the patient's ID and Sachiko number and confirmed that they have coverage, once a consultation is complete, I would fill out that claim form almost except online rather than physically, and that would then be emailed to the patient. We use an encrypted email. We email it to the patient, and the patient would then have to sign their component and send it into Sachiko to a specific email that Sachiko has given them. So it's really not very different to submitting a paper claim at all, except it's done online.
Okay, and following the lockdown, how will a patient know if telemedicine is still for them?
Well, that's really interesting. I really think this lockdown and this pandemic is going to change culture in the future. And I anticipate that people who were afraid of trying telehealth before, or maybe put off by the technology, might really embrace the convenience of this. And I'm hoping that going forward, if they have been comfortable with the technology and comfortable with the fact that it gives them extra convenience, no more, they don't have to sit in a waiting room, they don't have to struggle through traffic. If they're at home and not feeling very well, but don't want to get out of their pajamas, they can have a telehealth consultation or a video consultation. And I'm hoping that this will change culture for the better.
And Dr. Ames, why did you partner with Sachiko on this?
I'm so sorry, could you repeat the question?
Why did you partner with Sachiko on this?
What made me work with Sachiko? Well, Sachiko is a major Caribbean insurance company, and a lot of my patients are insured with Sachiko. So I approached them because I wanted my patients to be able to have the benefit of coverage for this, especially in light of the pandemic. I think it's great if insured people can actually have this reimbursed by their insurance company. And that way, they would also take the pressure off the public health phone lines or hotlines and free those up for the people who don't have the benefit of insurance. So I think it's two things. One, they get patients who are insured get to have continuity of care and able to speak to their own doctors. And two, it also frees up the public hotline for people who don't have insurance at the moment.
And would you know how doctors can sign up if they wanted to join the program?
I think Sachiko is doing a pilot at the moment, and I believe that anybody who has the correct technology in place can apply, but that's obviously a question for Sachiko. But that's my understanding.
Yeah.
And I think it's important that whoever is doing this service, whichever doctor is offering this service, has to think about the privacy of the service and the confidentiality of the service. So I personally use a medical grade platform that is with end-to-end encryption. So it's not WhatsApp, it's not FaceTime, it's not Zoom. And I would encourage any doctor who wants to pursue this telehealth option to make sure that whatever they're using meets international standards for privacy of health information, whether it be HIPAA or GDPR. So some kind of international standard for maintaining patient privacy and confidentiality.
And you're speaking about patients' confidentiality. Do you think Trinidad and Tobago nationals will open up to telemedicine?
I do. I think they have already. I've noticed since the pandemic a huge increase in consultations by video, not even from patients who just think they might have COVID-19, but also from patients, as I say, who are afraid to come to the surgery because they're afraid of maybe sitting in a waiting room next to somebody who might be coughing and that sort of thing. So I do think it will open up for them, because just like we're talking about the culture shift that this pandemic is going to cause with in-office working versus at-home online working and the way meetings are done, I think is going to cause a culture shift in medicine as well. I mean, if you think about it, doctors have been doing telehealth anyway for years. You know, when a patient calls up for a phone chat about their medication or about a follow-up on from a consultation, that is telehealth.
Right.
And it's just an extension of that. And in fact, I think video consultation in particular gives you so much more information than a telephone call.
Yeah.
So I really think it's here to stay. I don't believe that telehealth will ever completely replace a face-to-face consultation. Of course it won't, because there are still some conditions that clearly doctors cannot deal with or diagnose on video.
Yeah.
But I do think it's a useful augmentation to a doctor's practice and very convenient for the patient if there's a minor illness or follow-up from an ongoing problem.
Well, I'm happy you mentioned that, because my next question to you would have been, how would doctors pursue physical examinations and so on?
Well, I think the doctor and the patient both has to use one, common sense, and two, the doctor will have to use their clinical judgment as to whether it is safe for them to deal with that patient's condition on telehealth. So clearly, I would hope from a patient's point of view, if they think they're having a heart attack or they think they have acute appendicitis, clearly a doctor can't deal with this on video, because they will need ECGs, they will need blood tests, they will probably need oxygen. If they think they have appendicitis, then clearly the doctor is going to need to examine their abdomen. So the doctor will need to palpate or press on the abdomen.
Yeah.
And the doctor equally has to very quickly, most doctors who are experienced enough will realize within the first minute or so of a telehealth consultation, look, this isn't appropriate for telehealth, or just looking at them on the video, seeing if they're short of breath, seeing if they look pale or clammy or blue, or if they're unable to complete their sentences. A good doctor should very, very quickly, by eyeballing the patient in that first minute, no, this is not safe. I need to either call an ambulance for the patient, or bring them down to the surgery for a face-to-face consultation.
Mm-hmm.
And by the way, one of the things I do is I back up my telehealth consultations with a guarantee that if on talking to you, I or you then realize that this situation is more complex than it initially seemed, then I will bring you down to my clinic.
Right.
I'll offer you a same-day appointment or a next-day appointment, depending on how serious things are. I will bring you down to my clinic at no extra charge for that examination.
Right. Well,
so I think that's important. There's obviously a level of common sense on both. But in terms of examination, I can look at the back of a patient's throat very, very easily on video. The cameras these days are so good that I can see whether there's pus at the back of the throat, or if, meaning that the patient might actually need antibiotics, or if the throat is just red and inflamed because they have a virus and won't need antibiotics. Similarly, as I talked about, you can, listening to the patient, within the first minute, you can tell a lot from how a patient is looking, how they're talking, how they're moving. You can look at rashes these days on video. The cameras are so good. So there's a lot to be gained. And I have to say that people often forget this, but one of the first things you're taught at medical school is that 80% of the diagnosis is the history or the story. And the examination is really to confirm your suspicions.
Yes.
So really and truly, taking a good history is absolutely key on any telehealth modality.
Yes. So, so then there's no need for concern, really. Persons, you mentioned about the fact that it's okay with the type of cameras. So I'd imagine you'd have to give guidance to your patients as to what type of cameras they would need to have for the reciprocal. Yeah,
absolutely. So before the telehealth call takes place, Victoria, my receptionist, will just confirm that they have the right technology. So clearly you need some sort of device with an internet connection, a camera and a microphone.
All right.
And she will just talk them through the setup. I mean, my system is very, very easy.
Yeah.
They get emailed a secure link that they just have to click on.
Yeah.
So it's very, very easy.
All right.
Yes,
well, Doctor.
Obviously, we need to check that setup. We also encourage clients to have a form of ID ready, and we would have a form of ID ready, so that if we've not if we haven't seen the clients in a while, we can just confirm that's who the patient is. Looking at their driver's permit or their national ID, for example. And we encourage them to maybe prepare a little bit for the video consultation by having any medications they're taking to hand or any results to hand.
All right. Okay, Dr. Alexandra, we have the website up, which is www.sachiko. Okay, it was up on your screen, but want to thank you very much for coming and joining us this morning to give us that information. Telemedicine by Sachiko. Right now, though, we kick it upstairs to the news to the top of the hour.